Hey guys, what's up? Welcome to my YouTube channel. In this video, we are talking about trachea. The topics covered in this session are given here. First, we talk about the features of trachea. Then we come to the position. Then the relations or the structures related to trachea. Then we come to the structures that are actually present in the trachea, and we will end this session after discussing the blood supply and nerve supply. So without further ado, let us start. Okay, let us first come to the features of trachea. What do we mean by trachea? Trachea is a part of our respiratory system. It is basically a fibroelastic tube supported by cartilaginous skeleton or cartilaginous rings. So where it is present? First thing, that in which mediastinum it is present. So you see that it is basically present in superior mediastinum. In which plane? Yes, in median plane, in the midline. Now, before discussing the upper end and lower end, let us first see the length and diameter of trachea. So, trachea for an average adult is approximately 10 to 15 centimeter in length. And the diameter, you remember one thing, that when we discuss diameter, we generally take into account the external and the internal diameter. So the external diameter for males is approximately 2 centimeter. On the other hand, for female, it is approximately 1.5 centimeter. On the other hand, the internal diameter or the diameter corresponding to the lumen, it increases from the childhood to the adult. So during the first year of age, it is approximately 3 millimeter. On the other hand, in adolescence, it reaches up to 12 millimeter. And remember that this is the maximum diameter of the lumen achieved in trachea. Now we come to the upper end or the lower end of trachea. So what we are basically going to discuss is the extension of trachea. So remember that the upper end of trachea starts from the lower margin of cricoid cartilage. Okay, and this cricoid cartilage corresponds to sixth cervical vertebra, and it is guarded at the upper end by thyroid cartilage. So always remember that this thyroid cartilage acts as a shield for trachea. Okay, then it extends downward in the median plane, and it finally extends up to the fifth thoracic vertebra. Now there is also one interesting point, that this fifth thoracic vertebra also corresponds to the sternal angle of Lewis. So we can say that this is the sternal angle of Lewis where the trachea bifurcate. Remember, this is a very important anatomical landmark. Now, how it is present, we already say basically it is present in the midline and on the median plane. But one thing you have to remember, that although it is present on the midline, but on the lower part it slightly deviates to the left. Yes, on the lower part it slightly deviates, on the lower part it slightly deviates to the right. Okay, now we come to the next part, position of trachea. Here in this slide, basically we are visualizing trachea with respect to larynx. Here you see that this is epiglottis and this is mainly guarding the laryngeal inlet. Okay, we are saying that this is pharynx, this is nasopharynx followed by oropharynx, and this part it is the laryngopharynx. Yes, and after this laryngopharynx, basically for the food passage we are having esophagus, and for the respiratory passage we are having trachea. So trachea is basically starting from the lower part of larynx or the lower part of laryngopharynx. Yes, this is the position of trachea with respect to larynx. And here you also start that this is the manubrium sterni. So you can say that anteriorly to the trachea, manubrium sterni is present. It is a very important structure. We will discuss it in the structures related to trachea. Okay, let us come to the relations. In the diagram, you can see the three positions of trachea. Basically, not three position, two position. This is the first and this is the second. This is the position where the trachea bifurcates. So we are basically having a look on the upper diagram. Okay. What are the structures that are present anteriorly to trachea? First, it is the manubrium sterni. And second one, it is the arch of aorta. Structures present posteriorly, you can see if this is the trachea, then just posteriorly to it you are having esophagus. So posteriorly we are having esophagus, and it is very obvious that behind the esophagus we are having vertebral canal. Okay. Then on the right side and on the left side. So before discussing the right side and left side, I just want to draw your attention to one diagram where we are drawing the structures related to the right and left side of trachea. Here you have a look at this diagram. This diagram is a bit critical to understand, but let me explain you in a very simplified manner. Here what we are seeing, that we are visualizing trachea from the left side of the mediastinum and from the right side of the mediastinum. So if you are visualizing trachea from the left side of mediastinum, then the structures that are relating to the left side of trachea are seen anterior to it. Similarly, in the adjacent diagram, you are basically visualizing trachea from the right side of mediastinum. So the structures related to the right side of trachea are seen to be present anterior to it. So first we see the structures related to the left side of trachea. What are they? You see it is the arch of aorta. Okay, arch of aorta, left subclavian artery and left common carotid artery. Remember, these are the three main structures that are present on the left side and along with it anterior to the trachea. Okay, now we come to the structures related to the right side of trachea. Basically, you see that azygos vein is a very important structure that are present on the right side of trachea. Okay. So in this very simplified diagram, I'm going to draw the structures. First, the structure that are present on the left side of trachea. So what are they? Yes, I have already discussed. They are the arch of aorta, left common carotid and the left subclavian artery. So the arch of aorta, it will basically come posterior to the trachea, then it arches anteriorly. Yes, then it arches anteriorly, and on the left side of the trachea it gives rise to left subclavian and left common carotid. Remember, they are present anterior to the trachea. And on the right side you are basically having the azygos vein. So in the blue color I am drawing the azygos vein. Yes, so these are the structures that are related to the trachea. Now we come to the structural arrangement of trachea. But before discussing the structural arrangement, I just want to draw your attention to one three-dimensional diagram where I am showing the structures that are present in trachea. Here this is the three-dimensional model where I am basically visualizing the trachea, and I have removed, as you have seen, I have removed the vertebra behind so that you can even visualize the trachea posteriorly. So here I am zooming it, and you can see, as I have already said, that trachea is basically a fibroelastic tissue supported by cartilaginous skeleton, and this cartilaginous skeleton is nothing but cartilaginous ring. So you can see that from anterior side these cartilaginous rings are continuous, but on posterior side they are not continuous. So here this gives rise to a she-shaped appearance. So if this is a cartilaginous ring, basically this is a cartilaginous ring, then on the posterior side you are having no cartilaginous ring, but you are having basically some transversely arrayed smooth muscle cells. So these are the transversely arrayed smooth muscle cells devoid of cartilage, and this is mainly called trachealis. Yes, they are called trachealis. Now the trachealis has some separate nerve supply which I am discussing in my later slides, and also you remember one thing, that this is the incomplete cartilaginous ring. Remember, they are not complete cartilaginous ring, they have some functional significance also, which mainly gives a convex appearance of the tracheal tube. Okay, now also you remember one thing, that this trachea from the inner side, that is the lumen of the trachea, it is lined by ciliated columnar epithelium, so that it facilitates the transport, the transport of the dust particles and the particulate matter to the pharynx region. Okay, now in this three-dimensional model I am also taking the opportunity to visualize trachea in a much better way. As I have already said, that trachea, it is guarded on the upper side by this thyroid cartilage, and you already know that this is the cricoid cartilage, and this cartilage corresponds to 6th cervical vertebra, and this is approximately 10 to 15 centimeter long, and from where basically you are having the manubrium sterni. Yes, this is the manubrium sterni, and this is the region of bifurcation where you are having the sternal angle of Lewis. It is a very important anatomical landmark. I repeat it. After discussing the 3D visualization, we come to again the theory part. As I have already discussed, the trachea has a fibroelastic wall and she-shaped cartilaginous ring. What is the significance? Yes, it gives rise to mainly a convex posterolateral surface of the trachea. They are 16 to 20 in number, I already say. And what is trachealis? Trachealis are basically the transversely arranged smooth muscle fibers present on the posterior wall of trachea, where it is the devoid of cartilaginous ring, because we know they are not complete, they are incomplete, C-shaped. Now we come to the final topic of our discussion today, which is the blood supply and nerve supply of trachea. So arterial supply and venous drainage, both of them come to blood supply. So first the arterial supply by inferior thyroid artery, and we know that inferior thyroid artery, it is a branch of thyrocervical trunk, which is also a branch of subclavian artery. Clear? And the venous drainage, that the deoxygenated blood will drain to the left brachiocephalic vein. I think the blood supply is clear. Now we come to the nerve supply. The nerve supply we mainly discuss under two categories: sympathetic, parasympathetic, and sympathetic. Now the parasympathetic is mainly by recurrent laryngeal nerve. Now we know that recurrent laryngeal nerve, which is a branch of vagus nerve, it supplies all the intrinsic muscles of larynx except cricothyroid muscle. So this is the recurrent laryngeal nerve, which mainly supply the trachea also. And always remember that it has two functions, the motor and sensory. We know that vagus has both motor and sensory components. So the sensory part is actually to the mucous membrane, and the motor part is to the trachealis muscle. Yes, so it has sensory and secretomotor also. In some books it's written that sensory and secretomotor to the mucous membrane, so that any irritation in the mucous membrane, it can be detected or sensed, and it actually gives motor supply to the trachealis muscle. We already discussed what is trachealis. Now we come to sympathetic. Sympathetic is from the middle cervical ganglion. Okay, so in short, this is mainly the autonomic nervous system or parasympathetic and sympathetic nerve supply to trachea. Yes, in this way we have come to end our today's discussion. So if you like today's discussion, then please hit the thumbs up button below, and don't forget to subscribe to my channel. Please share my channel. Thank you very much.